It is entirely too early. Too early. And I'm not a morning person. And even though I've been doing this for a year and a half now, it is not getting easier. I do not get adjusted to the mornings. It takes me at least 2 to 3 hours before I'm like fully awake and ready to do something with my life. But gotta get there for sign out, so keep pushing through. So I just made it to work. Just getting settled into the garage. I'm gonna do a couple of deep breathing exercises to prepare myself for the day. Start my day with a little meditation exercise, and gonna go sign out so the night team can transition care and go home and get some rest because they'll be back tonight, obviously. So gonna get moving on. Time to start this day, get this shift started. All right, so I just finished sign out, and we have about 17 patients on the list for today. Our medicine services split up into 2 teams, and we have an admitting team and a non-admitting team. So basically, both services have about 17 patients right now. So on this shift, during the day, I'll cover 1 team. Overnight, I'll cover both teams. So I'll be responsible for roughly 34 patients, depending on how many patients get admitted. So right now I'm heading to do newborn rounds because I'm responsible for the babies as well this morning. So getting ready for that. One of the handy dandy things for newborn rounds. Comment down below if you know what this is called.
And I'm hitting my stride, clock ticking, never missing, no reason to hide. City passing while I'm moving, and I'm taking it in. Hitting every door, crashing, and I'm wearing a grin. Through those alleyways, tucking, navigating the wake. Every package is a hustle, I'm wide and awake. No slowing, improving, baking these cakes moving. Through with the take, ooh, with the thrill I create.
Rounds are done. Had to get some coffee so I can go finish the rest of my newborn rounds.
Like a knife, baby, and I'm cutting my way, I'm better.
Lord, please deliver us, deliver.
All right, so I have a really sick patient right now. I feel like that's been the story of the day today. We have a lot of patients, and a lot of them are pretty stable and are just really awaiting placement, but I have a handful, probably 4 to 5 that are really sick, and I've been putting out fires all day today with these same few patients. So I've been getting paged a lot, having to put in orders, figure out what's going on. At some point, night admissions are going to start coming in, and we usually get 3 overnight, so it's going to be an eventful evening. And I'm also covering rapid responses for the whole hospital as well. So right now we're looking at 36 patients for both teams that I'll be covering overnight. Newborn babies. I have one really sick baby that I'm kind of trying to figure out what's going on with him. And admissions overnight. And rapid responses. So it's shaping up to be a really busy night tonight. intern just went on to check out the new admission, the first admission, and I'm about to call down to the ER to see what the second admission is. Hey, this is Dr. Drayton calling about room 15.
Room 15?
Yeah,
Sorry, the thing went off right as you said that.
I hear it.
So, Mr. He is an 82-year-old gentleman, has a right nephrostomy tube that's become dislodged. So he has bilateral nephrostomy tubes. He has prostate cancer under treatment of oncology. Wife said they last emptied the bag last night before he went to bed. This morning there was no output from the right. He was having some pain, so she flushed it, got a little bit out, but since then nothing else has come out of the right side. The left is still draining. He's had worsening pain and some nausea and dry heaving throughout the day. His labs don't look terrible. Kidney function is about baseline. He's got a little bit of a white count. I talked to urology and they said for you guys to submit for IR to replace the tube in the morning.
Okay, sounds good. I'll come down shortly and see you.
Thank you very much.
Yeah, no problem, thanks. All right. It's time for a snack. This is the doctor's lounge. Got the game on. Dining area, of course. And some snacks. This is one of my favorite snacks. Gotta have this. More coffee. Strong for sure. I've officially reached zombie mode. Had a cup of coffee. Did absolutely nothing for me. So now I'm heading to look for a Celsius. It's been crazy. So many rapids have been called today. I've lost count. All right, I am heading down to the call room now to just try to lay my head down.
Going down.
Don't think I'll be able to do much of any napping or resting, but I'm just gonna go because I'm tired. I can barely think straight. Coffee feels like it should be kicking in soon, so maybe I'll get a second wind. All right, made it to the call room. There's a little TV up here, but finally a little peace and quiet. So I have reached 23.5 hour mark. I just woke up. Probably got about an hour and a half of sleep. A lot of pages overnight. There were no rapids, thankfully. And sorry, I am toast right now. There were no rapids overnight, but I did get paged frequently for little things, but that's fine. This was a tough shift. This was definitely one of the tougher shifts that I've done. Yeah, sorry, I can't even form a sentence right now. almost done. I just have to go wash my face, brush my teeth, so I can like wake up a little bit for sign out, and then that'll be the end. But I am just glad we are almost done. We are finished. 24-hour shift done. Let's go.
It's golden. Tension. Come blowing the breeze. We're rolling downtown. We're grooving to the sound. We're rolling downtown. The weekend's here and it feels so right.
And I'm back in my car, ready to go home. 24-hour shift is over. 24-hour shift is over. Feels good. Honestly, I just want to sit here for a second and sort of digest and process everything that happened over the last 24 hours, because it's a weird feeling when you work a 24-hour shift. You barely get any sleep, especially on a day that or on a shift like I had, where so much went on. You know, you're kind of in survival mode, so you don't really appreciate all the things that took place. And you know, as a second year, when you think about how far you've come from intern year to now, it's one of those things that you gotta just take some time to process and really appreciate how far you've come. Because when I think back on it, you know, a lot of those situations, intern year, I would have been freaking out. I would have been calling my attending every 5 minutes, you know, second guessing myself on every decision. And to see how far I've come from last year to this year, where most of the situations that came up, I felt pretty comfortable and confident handling it without calling the attending. The one thing that I did feel most uncomfortable with was the newborn baby, and that's because I just haven't done a whole lot of sick babies, and I have not done my pediatric inpatient rotation yet. So that was a little bit out of my comfort zone, but thankfully it wasn't anything too bad. And you know, I did let my attending know what was going on and what I was thinking, and he pretty much agreed with my thought process and my plan. And he excuse me, he said he would have made the same decision. So you know, it's a big growth point that I'm just going to try to take some time to process and appreciate. So if you're interested in seeing more videos like this, I will get better and make it more streamlined, or I'll try to. But send a like, drop a comment, subscribe, and post any content ideas or any feedback that you have for these videos, and I'll be sure to take a look at it, and I'll see you in the next video.